to allow the lung to expand. Let me explain real quick, okay? So let's just gonna draw just one lung for the sake of illustration. So you have a lung, that's lung tissue, right? Now, surrounding the lung, you have a sac. That sac is called the pleural sac. And what it does is it provides lubrication because it has a fluid. So every time your lungs expand, it lubricates it so it won't rub too much. Does that kind of make sense?
Yeah.
Okay. Now, the lung itself, you know, you have the main bronchial tissue, the bronchial tree, and then you have all these small little bronchioles, correct?
Yeah.
So when you have, are you familiar with atelectasis?
Yeah, collapsing of the lung.
Yep. How about pneumothorax?
Pneumo is air.
Both of these conditions are collapse of the lungs, but the difference is atelectasis is you always close, meaning there's nothing puncturing the lung. Pneumothorax could be also a punctured lung. So when you have a punctured lung, if you can imagine you get stabbed, let's say, right here. Well, now you've created a hole and the actual lung tissue, it shrinks. What I mean by that is the following. The lung tissue itself actually shrinks and it looks like this. It's like, okay, the lung gets really small.
Wow.
And so the whole goal, what we need to do is we need to get that lung to expand again, right? Now, how do we do that? Since there's so much gas that's developing here, it's creating a lot of pressure against the lung and it's keeping it collapsed. So what we do is we put a hole and we create a chest tube and it's supposed to take all that air or that fluid out, because if it takes it out, then the lung can now finally expand after that. And that's the whole purpose of a chest tube. The air goes out, now the lung can expand again. Does that make sense?
Yeah.
That's the whole purpose of a chest tube drainage system. Now, in this question, it says, you know, they're scheduled to have their chest tube removed. That means that the lung most likely expanded already. Does that make sense? And so, excuse me. And so we have to have it removed. But there's a specific technique that you have to know about. What action should the nurse take? Let's see if you know it.
So you mean from the choices or from the general knowledge or from the choices?
No, from the choices.
Yeah. Cover the insertion site with hydrocolloid dressing after removal, provide pain medication immediately after removal, instruct to perform monitor removal, delegate the removal of the chest tube to a licensed practical nurse. D is absolutely not an answer. Instruct the clinic to perform the removal.
I'm sorry, which one did you say?
Cover the insertion site with hydrocolloid dressing after removal.
Okay.
That's B.
Provide pain medication immediately after removal. It should be probably before the removal. So let me go through each one of these two, right? Now, since we're removing the chest tube drainage system, there's going to be a hole. You need to provide a dressing, but it's not a hydrocolloid. It's an occlusive dressing.
Occlusive dressing,
because the occlusive prevents anything from coming out. The air will not come out. Does that make sense?
Yeah.
Now, so now look, this is part of your foundation, meaning this is what you should know, that it's going to be a sterile occlusive dressing. So we can, if you knew that, then we could eliminate that. That's something you need to memorize. And I will always repeat that to you, by the way, okay? Chest tube removal, or if the chest tube comes out for whatever reason, occlusive dressing. Now, provide a pain medication immediately after removal. All pain medication will be given 30 minutes before a specific procedure because it takes about 30 minutes for the medication to exert its effect. Does that make sense, sir?
Yes.
So that's another rule. So we could eliminate that one as well. So we've eliminated two. C says instruct the client to perform the Valsava's maneuver during the removal. Do you know what the Valsava's maneuver is?
Is it like bending?
Not bending, it's bearing down. Where you take a deep breath and you like you're pooping. You bear down what that does is it anytime you're having any tube removed from your body, the Valsalva's maneuver is what you're going to educate your patient to do. That's an important concept that you need to understand, okay? And that's okay, because these are small details that we're going to be that I'm going to be emphasizing. It's okay. Delegate removal of chest to a licensed, nah, they don't do that.
Yeah.
So again, the rule is when the tube comes out, occlusive dressing, not hydrocolloid, medications are given 30 minutes before the activity. And then from now on, you know that whenever you're removing any tube, whether it's a chest tube, Foley catheter, or a Jackson Pratt drainage system, you always want to have the patient to take a deep breath and bear down, because that helps relax some of the muscles, believe it or not, and it allows the tube to come out. Does that make sense?
Yeah. Yeah.
Okay. With that being said, when somebody that Valsava's maneuver, are you familiar with it or no?
Yeah, I am. Yeah.
What does that do to what nervous system, what part of the nervous system does that maneuver activate? Do you know?
It's not the hypothalamus.
No, so it's going to be the parasympathetic nervous system.
Yeah.
And the parasympathetic nervous system is your rest and digest, which normally drops your heart rate and vasodilates. So because of that, I want you to remember, let me write this down for you real quick. So the Valsava's maneuver, it activates the parasympathetic nervous system, which causes lowers BP and heart rate. Right. So this is important for you need to understand this whole concept, right? Whenever you have a patient, if I'm your patient, I have a chest tube drainage system inside of my chest, right? You're going to be removing it. So while you're removing it, you tell me, do the Valsava's maneuver. How do we do that? We bear down. We got that, right, sir?
Yeah.
But you may get questions that ask you which situations or which circumstances may contraindicate the Valsava's maneuver. And if you understand that doing what I just told you about, it activates the parasympathetic nervous system, which means it drops your heart rate, it drops your blood pressure. You don't want to do that to patients who have cardiac issues. If they're post-MI, if they just came back from a CABG procedure, if they have heart issues, you can't do that because it's going to lower the heart rate and create an unstable vital condition. Does that make sense, sir?
Yeah. Yeah.
So I want you to know that that the Valsava's maneuver is contraindicated for cardiac patients. And they have to have an active cardiac issue, like they're having a heart attack, they just had a heart attack, they're recovering from a heart attack, or they had a surgical procedure of the thoracic cavity. Does that make sense, sir?
Yeah. Yeah.
Any questions or clarification on this so far?
No.
Okay. So on to the next one.